again to the Wellness Show. I am Dr. Keisha Christian, your host, and I'm so excited for the episode that we have today. We have a great person that is full of knowledge with animals. She has a passion for animals, and she's a veterinarian. Her name is Dr. Jen Shults, and we're so glad to have her here today. She's going to share with us about her business, which is Quartet Veterinary Specialty Emergency Hospital, and where she practices veterinarian rehabilitation. So without further ado, I introduce to you and welcome Dr. Jen Shults. Thank you so much for joining us today. So share with us your passion for animals.
Yeah, so I've wanted to be a veterinarian since I was about 5. That's not unusual in the veterinary community. I think most of us have a passion for what we do and feel that as a calling. So I was always, once I got a little bit older and closer to vet school and through college, was always interested in the lameness and imaging side of things, initially with horses, and then just kind of transitioned that into what I do now, which is mostly canine rehabilitation and pain management. So.
Okay, great. That is wonderful. I can imagine that was a lot of extensive education that you had to go through. And
well, like any veterinarian, you go to college. I have undergraduate degrees from NC State. Took a couple years off and worked full-time as a veterinary assistant before going to vet school, which is another 4 years, and then did a 1-year rotating internship in Fairfax, Virginia, in small animal medicine. So emergency medicine, surgery, neurology, all of that. Came back home and started practicing in emergency medicine, and then went through additional training for my rehab certification. So.
Wow, that's an impressive educational profile. Thank you for sharing that. And so the name of your practice is Quartet. Tell us a little bit about what that stands for.
Yeah, so we moved into our new building about 10 months ago, and had the opportunity to really think about our brand and what was important to us as a group of veterinarians. And the thing that really came through was that we all really cared about not only patient outcomes, but client education and keeping our primary or referring veterinarians in the loop about what was going on. And that's where Quartet came from. So our Quartet of Care is the patient, of course, the client, our referring veterinarian, and us as the specialty veterinarian. So no matter which department you see, whether that's rehab or surgery or emergency, we always keep that in mind. And certainly we have a lot of patients that see multiple services within the hospital and want to keep that education and communication going within the hospital as well.
That's great. I love it. It's such a team approach.
Yes.
And I can imagine with the team approach, the rehabilitation and the treatments for the pet is definitely effective.
Yeah, I mean, what I love about rehab is that it's a very functional approach. I mean, we'd all love to say as veterinarians that we always find the exact thing that's wrong with your pet, right? And that's not always true, either because it's beyond the reach of what diagnostics are available to us, which are more than they ever have, or we can't do all those diagnostics, because let's face it, veterinary care is expensive.
Sure.
Every patient comes with a client who ultimately has to pay that bill, and we don't always get to do the $2,000 MRI that would give us the answer. And so what I love about rehab is we can say, okay, well, this patient isn't able to move at home as well as they should. And we take a very functional approach. Where are you painful? What legs don't work? Why don't they work? What do the muscles feel like? What do their joints feel like? And come up with an approach that helps keep them moving and active and addresses their pain, kind of regardless of what their underlying condition is. Sometimes we have dogs that we can't address their underlying condition. Maybe they have a tumor that can't be removed. That doesn't mean that we can't improve their quality of life.
Right. And so important. And as you were speaking, veterinarian rehabilitation is so simple, and it's related to human rehabilitation.
Right.
And a lot of what we as physical therapists actually look into is the quality of life. And we don't treat just a specific area that they may be coming to us for, but we treat the whole person. So I know you touched on that a little bit.
Yeah, you have to look at how they, just because let's say they have a knee problem, right, which are very common in our dogs, that doesn't mean that they're not then maybe putting more weight on their front legs. Maybe they have a muscular trigger point up front. So if you just look at, where your diagnosis is or where they seem painful, then you miss the whole picture of what's going on. And there's so many more things that are available to us, but I love how, in my rehab training, I learned from, yes, veterinarians, veterinary orthopedists, veterinary neurologists, but from a lot of physical therapists that come from a different perspective and a different training.
Absolutely, absolutely. And again, that goes along with the whole team approach, which I love.
Yeah.
So tell us at Quartet, what type of animals do you typically see for
We
veterinary
primarily see dogs and cats.
Mhm.
On emergency, certainly we deal with some wildlife things, but we primarily see dogs and cats, and certainly on rehab we see mostly dogs. There are some cats. Cats have more pain than we thought they did. They're not always good about communicating that to us.
Sure.
Certainly arthritis is more of an issue in our cats, and they're not always the most willing participants, but we work within what cats do. And then we see dogs. I think my smallest patient is 2.5 pounds.
Wow.
And my biggest one was 300. So
Wow.
everything in between.
I just saw a very cute chihuahua actually in the lobby. And by the way, your staff, your supportive staff, they are wonderful. They're so caring and loving to all of the animals that come through. And so that is so reassuring for, I'm sure, the pet owners that they will receive the proper care and love and attention that they do need for their pets.
Well, absolutely. I think, your first impression when you walk in the building is the people sitting at the front desk.
Absolutely.
And, the people that you interact with first. And so our reception team is fantastic. Because we're segmented into the different services, when you come to rehab, you have staff members that work primarily on rehab, and they have a deep wealth of information as well. Your emergency staff work on emergency. Your surgery staff, do anesthesia and surgery day in and day out. So they have a lot of knowledge that our staff bring. Certainly we want them, that's part of their team, our service to our staff internally to make sure that they're happy. And just like veterinarians, veterinary staff get into it because they feel a calling to it. You won't find anybody here that doesn't truly love what they do.
Absolutely. You have to have a passion, and that's understandable. And your new facility is beautiful, by the way, and it's so amazing how the layout is with rehabilitation and surgery area and emergency. So it's a very nice facility. Congratulations.
We put a lot of thought and effort into trying to lay it out the best way, trying to have a welcoming lobby where we could potentially, there could be a lot of people because emergency gets busy, but where there were segmented, really welcoming lobby. Rehab is not a super well-known specialty on the veterinary side. It was only officially recognized as a specialty about 7 years ago. And so the rehab rooms are right off the lobby. So any client can come down, they can see into our rehab treatment areas and see what's going on. I think that's really important.
It is. And
our owners stay for the majority of treatments. And then
that's great.
what you see is the exam rooms down the hallways, and then all the patients are in cohesive areas in the back. The surgery suites are all grouped in the back, so that even though it's a big building, kind of keeping things close where we can.
Absolutely. And you're located in Cary, North Carolina, on Carpenter Fire Station Road. And it's a great location. It's nice and quiet out here and easily accessible, so it's nice. It's very nice. So tell us some of the types of injuries and physical illnesses that you see in some of your animals that you treat.
So I do everything from evaluations of what I would call adolescent dogs that maybe are going into dog sports to make sure that their conformation is appropriate, to dogs with musculoskeletal injuries, tendon injuries, ligament injuries, certainly some recovering from fractures or other orthopedic injuries that needed surgery, dogs with neurologic problems that are not surgical, like a fibrocartilaginous embolism, which is sort of a stroke to the spine, and dogs recovering from spinal surgery. And then I see a lot of senior patients because, our older dogs can have significant pain or dysfunction. Our dogs are living longer and longer. We're taking better and better care of them. They're becoming more and more of a part of the family. So pain management at senior pets is definitely one of my passions, and I see a lot of those dogs.
Absolutely. And how do you determine how much pain a pet has? Of course, there's a language barrier, but how do you determine what's needed in a physical therapy program when you are actually working with an animal for specifically pain management?
Yeah, so we start with an initial evaluation, right? So we generally block 1.5 hours to 2 hours for those appointments because we don't want to rush through them, and we want to make sure the client understands everything that's going on. So I do a brief general exam like any veterinarian would do. We do a gait evaluation. So how do they move around the room? Can they get up and down on their own? Do they need help? Can they get up and down on something with good traction like a piece of yoga mat but not on our vinyl floor, right? How do they sit up and down? Can they lay down comfortably? go through a full musculoskeletal exam, starting down at the toes, all the way up every leg. How do their joints move? How do their tendons move? How do their muscles move? We have trigger points. And a neurologic exam to make sure that they know where all their feet are and can place them appropriately. And that's after I've listened to the owner talk about their concerns. Why did they come in, right?
Sure.
How is their pet moving at home? And so from there we figure out, you know, sometimes it's easy. Sometimes you move something and they yelp, oh, you're painful. My goal is to never make them yelp during an exam. Sometimes it's just they're standing differently. Dogs have a way they should stand, just like people have a way they should stand. And so if they're not putting as much weight, or they're rounding their back, or they're shifting, then something's got to be hurting. But we certainly see a lot of patients that their owner's like, well, they never cry out and they still want to go for their walks. Remember that a lot of our dogs especially were bred to do something, right? You take a border collie that was bred to herd, they want to go and run. It doesn't matter. They could have a broken leg and they would still run and try to run and play.
It's part of their nature.
Right, that's their drive. And so their drive or their determination or their personality certainly plays a role in how well they express that pain.
Interesting, interesting. And so what type of treatment techniques do you employ in your physical rehabilitation programs?
Right, so of course we're going to use some pain medications. I try to stay away from them when we can or when appropriate.
Sure.
We use a lot of soft tissue mobilization, so massage type techniques, as well as specific joint mobilizations that come from physical therapy. I do myofascial trigger point needling, which is a great way to break up trigger points. We use class 3B and class 4 therapeutic lasers, therapeutic ultrasound, TENS and NMES units. We have a whirlpool with a whole body TENS in it, underwater treadmill, a gym where we have lots of equipment for therapeutic exercise for pets, and I have an acupuncturist on staff who also does herbal therapies.
Nice.
So, and we work with some chiropractors in the area for dogs that need that sort of work.
Interesting.
So we certainly do a wide array of things out there, and the package that we put together for every pet is different. And sometimes that's the pet. Maybe you have a pet who hates to take oral medications. Then we don't want to force the owner to have to, oh, here's 5 medications you have to give your pet. Some dogs love coming to the office and are going to come in and do maybe a laser treatment. Some pets would prefer to stay at home, so maybe we're sending an at-home device, like a pulsed electromagnetic field device, like in a CC loop. And we also fit a lot of assistive devices, whether those be help them up harnesses, toe grips, custom orthotics and prosthetics and support braces. So the plan for that dog is going to vary based on what the owner can do, what the pet can do, and kind of their personality. And I think the best thing about rehab is individualizing that treatment for every pet. We start somewhere. This is what we think is going to work. Then we have to reassess and tweak as it goes along.
Absolutely, absolutely. That sounds wonderful. And a lot of the techniques that you shared and you talked about, it's similar to the physical therapy techniques that we employ in rehabilitation with humans. So that's really interesting. Recently, I've been reading a lot of actually evidence-based rehabilitation for pets, and it's just interesting how it has evolved over the years. And I know you mentioned that it's just been the last few years that it has been known as a specialty. So congratulations with that. And I'm so glad that you're here in Cary and providing these services. A lot of people need to know that these services are out there for them. You know, for pets who may be in pain or may have an injury or even arthritis or a condition that needs your attention, it's nice to know that you are here and you have the knowledge, the staff, as well as the equipment to assist them in their rehabilitation process. And I know you do a lot of observation of the pets too. I know that sometimes you do have dogs and other pets that are here for a longer period of time than just maybe a typical session that you have. So that's great that you're able to observe them and making sure that they're improving and on target for their rehabilitation program.
Yeah, we have patients that stay with us. You know, if you have a 14-year-old dog that is getting a lot of things and you're going out of town for a week, you know, that can be hard if you don't have someone that you trust. And so we have some of our rehab patients that stay with us, or those that are recovering from surgery and they really need daily intensive rehab, and so they stay with us in the hospital until their owners are able to handle it at home. So Yeah, we, our rehab patients are part of our family. They're in here every week a lot of times.
Right.
And we get to know them as well as we know our own pets sometimes. So.
That's excellent, excellent. So share with us some of the misconceptions that you've heard there in terms of what people think about veterinarian rehabilitation, maybe.
Yeah, I would say what most people hear about, kind of the buzzwords in vet rehab, are laser and underwater treadmill.
Okay.
And there's really so much more out there. A laser is not just a magic stick. Yes, it works for a lot of different things, but it's certainly not the only thing that we use.
Right.
I love the underwater treadmill. I think it's a great tool. But I have clients that can't afford to come in and put their dog in the underwater treadmill every week. And we think that home exercise and programs are very important, even for the dogs coming into us, to supplement what's going on at home. So I think the biggest thing is to know that there are options for your dog.
Sure.
Even a lot of my veterinary colleagues in general practice, God bless them, they have to keep up with so many more different things, right? They have so many more systems of the body
Absolutely.
to evaluate than I do. I'm lucky, I get to focus just on this, and so I get to go to continuing education just about rehab and orthopedic and neurologic disease. And I get to play with a lot of toys that aren't available at a general practice.
Right.
So I would say, probably the biggest thing is realize our exam is going to be very different than your general exam. I work with a lot of the area veterinarians. They know that, they respect that. I respect their mad skills too. And so we really want to realize that the exam is the most important part. Finding the right diagnosis, finding that dysfunction where they're not using, especially muscular problems, trigger points are not talked about enough in human medicine, much less veterinary medicine.
Absolutely.
And so we want to find that and then make a treatment plan.
Sure.
And that could involve things here, that could involve things at your regular vet, or that can involve things that you do at home, and it's finding the right approach for you and your pet.
Absolutely, and that sounds great. Now tell us the many benefits of having veterinarian rehabilitation. I know you touched on it in our discussion so far, but just a few of the many benefits of.
I think the biggest thing is keeping our pets functioning as close to normal for as long as possible, right? I want that dog that had an injury that's 3 years old to get back to running and playing and ball or frisbee or whatever they want to do. I want our older pets to be able to maintain that independence and mobility on their own. I hate when an owner has to make a decision too early that their dog is too painful to get up and move.
Sure.
So that's really where I see is that we're really not only improving the animal's quality of life, but their bond with their family. Because that human-animal bond is why we're here.
Absolutely, absolutely. And there are some very distinct differences between humans and animals, but one commonality is that, we all want love. We all want love and attention and to be cared for, and the friendship. It is so true what they say that a dog is a man's best friend. And I love North Carolina because it's such a pet-friendly state. We have lots of different dog parks that are popping up, so we see dogs that are exercising and getting out, getting fresh air, exercise, and it's just wonderful. It's wonderful to see that in our community, so that's wonderful. So I'm so glad that you took the time to spend with us today. You've provided with us a wealth of information and such a needed specialty in this area. If you all have not heard about Jennifer Shults at Quartet, please give her a call. If you have any questions, concerns, or want an evaluation for your pet, give them a call. They're a wonderful group and team here. I've just felt like just at home here, and I know the pets do too. They appear to be quite comfortable here, so definitely give them a call. Again, they're located in Cary, North Carolina, Carpenter Fire Station Street. I'm sorry, Road. Sorry about that. And their doors are open to the public, and they would love to help you in continuing to build that bond with your pet and make sure that they're comfortable and they do have a quality life, not only today, but in the future. And that's what we're here talking about is wellness. We want to make sure that the animals are well taken care of and they have a quality of life and are happy today, tomorrow, and days to come, as well as years to come. So thank you so much for joining us today, and we look forward to hearing all about you and your practice in years to come, and good luck, best wishes to you and Quartet.
Okay.
Thank you so much.